number 2, Ethical and Legal Issues in Dentistry. So what is ethics in dentistry? Well, it's the appropriate morals, values, and behaviors that as they relate to patient care and the practice of dentistry. The Code of Ethics is a set of voluntary controls put in place to assist on the self-regulation of the profession. There are the ADA, ADHA, and ADAA that all govern and watch over the Code of Ethics in dental practices. The State Dental Practice Act, its primary purpose is protecting the public from incompetent or unethical dental professions. It generally includes the following: licensure requirements, continuing dental education requirements, what duties can be delegated to dental auxiliaries, which means to dental assistants and hygienists, and guidelines for infection control, guidelines for those offices that do expose dental radiographs, which is x-rays, and situations that would lead to the suspension and revocation of the dental license. The State Board of Dental Examiners is the governing body which administers these exams that are required for licensure and enforcement of statutes and regulations. There are different types of dental auxiliary supervision, and the State Dental Practice Act is very specific per state which procedures are allowed to be delegated, as I said, to dental assistants and hygienists. So patients of record, number 1, a patient of record is a patient that's been given a treatment plan by a licensed dental profession following an examination. That's a patient of record. Direct supervision means a procedure that's performed by a dental assistant on a patient of record following an exam while the dentist is physically located within the office. General supervision, also known as indirect supervision, is a procedure performed by a dental assistant on a patient of record following an examination while the dentist is not physically within the dental office. In some states, dental assistants can actually perform procedures on patients without the dentist actually located within the dental office. Such procedures include making temporaries, re-cementing temporaries, or sometimes even in-office whitening. But ultimately, letter E says respondent superior is the supervising dentist is the one who is ultimately responsible for any acts that are carried out by an employee according to the dentist's instruction. So there are 2 types of credentials that dental assistants can get. One is the CDA and one is the RDA. I'll let you read more about them, but know that it's a state-by-state designation as to if a dental assistant needs either of these, or if they do, which one their state needs. So contact your local state Dental Practice Act to determine if one of these is actually needed in your state. The entire dental team should employ certain practice and techniques to decrease the likelihood of a malpractice lawsuit. The following are set in place to manage this risk. First, charting. Keeping accurate and complete detailed records is the best way for a dental team to protect themselves against legal action. Always obtain an informed consent prior to treatment. We'll talk a little more about informed consent in just a second. You also must deliver high quality dentistry and have high standards of clinical quality. Great communication with patients and keeping really great rapport is also essential. So legal issues to know about are consent. When a patient accepts or approves the recommended or performed treatment, that's consent. Battery is harmful physical contact or illegal activity. To treat a patient without consent is considered battery, not likely in a dental office. Informed consent is written consent, and this is the most recommended method of consent. When informed consent is given, the patient or the patient's guardian is given a written explanation of the prescribed recommended treatment. They're also given the opportunity to ask all questions, and those questions are answered. If an implied consent is given, that means this is not the recommended form of consent. And this type of consent is given by the actions of the patient. It is implied that the doctor is working on behalf or the best interest of the patient. An example of this would be if a patient was sedated. If they were sedated and couldn't read a written explanation and actually sign their name and ask all their questions, if during that procedure the doctor has to work just for the best interest of the patient, that is an implied consent.